Welcome back, nursing stars of tomorrow. Ready to strengthen your NCLEX game? In today's video titled Pharmacology of the Gastrointestinal System, we're diving into one of the most high-yield sections for your NCLEX preparation. You'll get 20 exam-style questions, each followed by clear clinical explanations to boost your understanding and sharpen your test-taking skills. These questions focus on medications commonly used in conditions like peptic ulcer disease, pancreatitis, diverticulosis, hepatic encephalopathy, and more, all of which are frequently tested on the NCLEX. We release new videos every single day, covering the most important NCLEX topics and question types to help you stay ahead and pass with confidence. So make sure to follow us, watch our videos regularly, and stay with us till the end, because what you learn here today could show up on your exam tomorrow. Wait a moment before we continue. This could change your entire NCLEX prep. Our Complete NCLEX Review Course includes 100 hours of animated lectures, 500 hours of deep dive teaching, 5,000 powerful practice questions, 500 NGN-style items, and 15 full-length exam simulations. You'll also receive a full-access NCLEX eBook for 12 months. The course is now 70% off, but not for long. Tap the link in the description and get started right now. All right, future nurses, let's jump into question number 1. The nurse is educating a client who was recently prescribed metoclopramide for persistent nausea and delayed gastric emptying related to diabetic gastroparesis. During the follow-up visit, the client reports new symptoms. Which clinical manifestation requires the most urgent follow-up by the nurse? Now, let's carefully look at the answer choices. Option A, fever. Option B, tardive movements. Option C, sedation. Option D, dry mouth. Before we reveal the correct answer, think about which of these symptoms could signal a serious or potentially life-threatening complication. The correct answer is option A, fever. Now let's break down why this is the most critical response. When a client taking metoclopramide reports a fever, it raises concern for neuroleptic malignant syndrome, a rare but life-threatening emergency. Though more commonly associated with antipsychotic drugs, neuroleptic malignant syndrome can also be triggered by dopamine antagonists like metoclopramide. This syndrome typically presents with dangerously high fever, rigid muscles, altered mental status, unstable blood pressure or heart rate, and elevated muscle enzymes. If suspected, immediate action is required. The medication should be stopped at once, and the client needs urgent medical attention, often in an intensive care setting. While tardive movements, also known as tardive dyskinesia, may develop after long-term use and are concerning, they are not immediately life-threatening. Sedation and dry mouth, on the other hand, are expected side effects and do not call for emergency intervention. All right, let's test your clinical judgment with question number 2. The nurse is caring for a hospitalized client with advanced cirrhosis who has recently exhibited signs of hepatic encephalopathy. The provider initiates lactulose therapy. Which clinical finding would best indicate that the client is experiencing a therapeutic response to this intervention? Now, let's take a close look at the answer choices. Option A, decreased serum creatinine. Option B, increased level of consciousness. Option C, decreased abdominal girth. Option D, reduced total bilirubin level. Before we dive into the correct answer, think about how lactulose actually works and what clinical sign would show us that it's doing its job. The correct answer is option B, increased level of consciousness. Now here's why this makes sense. In hepatic encephalopathy, the liver is unable to break down ammonia effectively, and that buildup of ammonia in the bloodstream can alter brain function. Lactulose helps by trapping ammonia in the gut and getting it out of the body through frequent soft stools. As ammonia levels decrease, the client's mental status and alertness generally improve. So, an increased level of consciousness is the clearest sign that lactulose is working. Decreased creatinine might suggest improved kidney function, but it's not connected to lactulose. A drop in abdominal girth relates more to ascites treatment, and bilirubin levels are not directly affected by lactulose therapy. The key is watching for neurologic improvement. That's how you know the medication is having a therapeutic effect. Time to sharpen your pharmacology instincts with question number 3. The nurse is reviewing the medication plan for a client newly diagnosed with peptic ulcer disease confirmed by endoscopy. The client reports intermittent epigastric pain and burning that worsens at night and improves with food. Which medication does the nurse anticipate the provider will prescribe to reduce gastric acid secretion and promote ulcer healing? Let's break down the options and figure out which one directly targets acid suppression. Option A, sucralfate. Option B, calcium carbonate. Option C, famotidine. Option D, loperamide. Before we reveal the correct answer, consider which of these medications is designed to reduce gastric acid production at its source. The correct answer is option C, famotidine. Here's why. Famotidine is a histamine 2 receptor antagonist that works by blocking histamine at histamine 2 receptors in the parietal cells of the stomach, leading to a decrease in acid secretion. This reduction in acid allows ulcers to heal effectively and helps prevent further damage. While sucralfate does help by coating ulcers and protecting them from acid, it does not reduce acid production itself. Calcium carbonate is an antacid that neutralizes acid temporarily, but does not stop the stomach from producing more, and can even lead to rebound acid production if overused. Loperamide, meanwhile, is used to manage diarrhea and has no effect on acid secretion or ulcer healing. For this client with classic signs of peptic ulcer disease, including pain that worsens at night and improves with food, famotidine would be a frontline medication choice to reduce acidity and support healing. One quick heads up before we begin. If you're serious about passing the NCLEX, the Complete NCLEX Review Online course has every resource you need. 100 animated hours, 500 in-depth lectures, 5,000 questions, 500 NGN items, and 15 simulated exams. You'll also get a 1-year NCLEX eBook to study anytime. Right now, get 70% off. Limited time offer. Click the link below and take your first step toward passing. Let's challenge your critical thinking with a high-stakes scenario in question number 4. The nurse is caring for a hospitalized client who presents with sudden onset, diffuse abdominal pain, high fever, and a rigid, distended abdomen. The client is diagnosed with acute peritonitis secondary to suspected bowel perforation. Which medication should the nurse anticipate the primary healthcare provider will prescribe as part of the initial treatment plan? Now take a close look at these options and think about which one targets the root cause of this emergency. Option A, ondansetron. Option B, ciprofloxacin. Option C, ranitidine. Option D, dicyclomine. Before we uncover the correct answer, ask yourself, which medication directly addresses the life-threatening infection in this situation? The correct answer is option B, ciprofloxacin. Ciprofloxacin is a broad-spectrum antibiotic from the fluoroquinolone class and is frequently used to manage severe intra-abdominal infections like peritonitis. When bowel perforation occurs, bacteria from the gastrointestinal tract enter the normally sterile peritoneal cavity, creating a high risk for overwhelming infection and sepsis. That's why initiating empiric antibiotic therapy as early as possible is crucial. Ciprofloxacin, especially when paired with metronidazole, offers effective coverage against both gram-negative and anaerobic organisms during the initial critical window. Ondansetron may help with nausea, but it doesn't treat infection. Ranitidine is used to reduce gastric acid, and dicyclomine is an anticholinergic that reduces intestinal spasms. Neither are appropriate or effective in this emergent infectious scenario. Rapid recognition and antibiotic treatment are key to stabilizing clients with acute peritonitis. Here comes a high-yield toxicology question with question number 5. A nurse is caring for a client who presents to the emergency department with suspected acetaminophen overdose. The provider initiates intravenous N-acetylcysteine therapy. Which of the following best describes the primary mechanism of action of N-acetylcysteine in this clinical situation? Let's examine each of the options to figure out which one accurately explains how this antidote works. Option A, neutralization of stomach acid. Option B, neutralizing harmful byproducts of acetaminophen metabolism. Option C, inhibition of prostaglandin synthesis. Option D, activation of hepatic cytochrome enzymes. Before selecting the correct answer, focus on what actually causes liver damage in an acetaminophen overdose and how N-acetylcysteine intervenes. The correct answer is option B, neutralizing harmful byproducts of acetaminophen metabolism. N-acetylcysteine is the specific antidote for acetaminophen toxicity, and it works by binding to and detoxifying a dangerous compound called N-acetyl-P-benzoquinone imine, which is produced when the liver metabolizes excessive amounts of acetaminophen. Under normal circumstances, N-acetyl-P-benzoquinone imine is safely neutralized by glutathione, but in overdose, the liver's glutathione reserves become depleted. N-acetylcysteine acts as a precursor to glutathione and also directly binds N-acetyl-P-benzoquinone imine, protecting the liver from severe damage. That's why early administration, ideally within the first 8 to 10 hours, is so crucial in preventing liver failure. Neutralizing stomach acid, as in option A, is unrelated and pertains to antacids. Option C refers to non-steroidal anti-inflammatory drugs like ibuprofen. Option D describes a process that actually contributes to the creation of the toxic metabolite, not its neutralization. In short, N-acetylcysteine saves the liver by stopping N-acetyl-P-benzoquinone imine in its tracks. Let's put your medication safety knowledge to the test with question number 6. A medical surgical nurse is monitoring a client with long-standing diabetic gastroparesis who has been receiving intravenous metoclopramide 10 milligrams every 6 hours for the past 24 hours. Which new assessment finding requires immediate notification of the primary healthcare provider? Let's take a close look at each option to identify which one signals a potentially dangerous reaction. Option A, muscle rigidity of the neck. Option B, mild sedation and fatigue. Option C, 2 soft, loose stools over the last shift. Option D, increased appetite after meals. Before we go over the correct answer, think about which of these symptoms might point toward a serious neurological complication. The correct answer is option A, muscle rigidity of the neck. This finding is highly concerning for an acute dystonic reaction, a type of extrapyramidal symptom that can occur with dopamine receptor antagonists like metoclopramide. These reactions often involve sudden, involuntary muscle contractions, and when they affect the neck or airway, they can lead to laryngeal dystonia or opisthottonos, which may compromise breathing. This situation requires immediate discontinuation of the medication, prompt notification of the primary healthcare provider, and administration of medications such as diphenhydramine or benztropine to reverse the reaction. On the other hand, mild sedation and fatigue are common side effects and not emergent. 2 soft stools simply indicate that the drug is working as intended to increase gastric motility, and increased appetite after meals is actually a sign that gastric emptying has improved, which is exactly what we want in clients with gastroparesis. But muscle rigidity in the neck, that's a red flag, and fast action is essential. Let's tackle a fluid and electrolyte management scenario with question number 7. A nurse is caring for a client with decompensated liver cirrhosis who has just undergone large volume paracentesis for ascites. A total of 6 liters of fluid was removed. To prevent post-procedure hypovolemia and associated complications, which intravenous fluid does the nurse anticipate the provider will prescribe? Now think critically about which fluid helps maintain circulating volume after major fluid removal. Option A, 0.9% sodium chloride. Option B, albumin. Option C, lactated Ringer's solution. Option D, dextrose 5% in water. Before we move to the answer, consider what kind of fluid will stay in the intravascular space and support blood pressure most effectively. The correct answer is option B, albumin. Albumin is a colloid solution that exerts oncotic pressure, meaning it pulls fluid into the blood vessels and keeps it there, which is exactly what's needed after removing more than 5 liters of acidic fluid. When that much fluid is withdrawn, there's a high risk of circulatory collapse and hypovolemic shock unless we intervene. Albumin helps prevent post-paracentesis circulatory dysfunction by expanding plasma volume far more effectively than crystalloids. While 0.9% sodium chloride and lactated Ringer's solution are isotonic crystalloids, they don't provide sustained oncotic support and may even worsen third spacing. Dextrose 5% in water, once metabolized, becomes hypotonic and shifts into cells, making it a poor choice for vascular volume replacement. Albumin is the gold standard here. It helps protect against hemodynamic instability and supports renal function after a large volume paracentesis. Let's shift gears to pharmacologic management of gastrointestinal conditions with question number 8. The nurse is reviewing the medication profile of a client newly diagnosed with a gastric ulcer. The provider prescribes cimetidine in addition to a combination antibiotic regimen. The nurse recognizes that the primary role of cimetidine in this treatment plan is to manage which underlying condition. Let's go through the options and pinpoint which one aligns with the purpose of acid suppression in ulcer therapy. Option A, cystic fibrosis. Option B, Clostridium difficile infection. Option C, Helicobacter pylori. Option D, Crohn's disease. Before we look at the correct answer, think about which of these conditions commonly causes gastric ulcers and requires both acid suppression and antibiotic therapy. The correct answer is Option C, Helicobacter pylori. Cimetidine is a histamine 2 receptor antagonist that works by blocking histamine on the parietal cells of the stomach lining, which reduces gastric acid secretion. In the context of Helicobacter pylori-associated gastric ulcers, reducing acid helps promote mucosal healing and enhances the effectiveness of the antibiotics used to eradicate the bacteria. While proton pump inhibitors are more commonly used today, cimetidine may still be part of a treatment regimen, particularly in cases where cost or availability is a concern. Cystic fibrosis affects the lungs and pancreas and is unrelated to acid control. Clostridium difficile is a bacterial infection of the colon treated with targeted antibiotics, and acid suppression may actually increase the risk for this infection. Crohn's disease is an autoimmune inflammatory bowel condition managed with immunosuppressants and biologics, not histamine 2 receptor blockers. So in this case, cimetidine plays its role by supporting Helicobacter pylori ulcer management through acid suppression. Let's pause for a second. Are you ready to take the NCLEX with confidence? If not, don't worry. The Complete NCLEX Review Course has 100 animated hours, 500 recorded hours, 5,000 high-yield practice questions, 500 NGN cases, and 15 mock exams built to mirror the real test. You also get a 1-year eBook. Enroll now and get 70% off. Limited time offer. The link is right in the description. Let's test your understanding of safe infusion practices with question number 9. The nurse is monitoring a client receiving total parenteral nutrition along with a separate intravenous lipid infusion. During routine assessment, the nurse observes that the fat emulsion infusion is behind schedule by approximately 90 minutes. Which nursing action is most appropriate in this situation? Now let's review the options and think carefully about the safest and most evidence-based approach. Option A, reprogram the infusion pump to administer the remaining volume over half the scheduled time. Option B, administer a fluid bolus to compensate for the delayed infusion. Option C, confirm that the fat emulsion is infusing at the prescribed rate and continue as ordered. Option D, pause the fat emulsion and resume it with the next scheduled total parenteral nutrition cycle. Before identifying the correct response, consider what action maintains safety and prevents complications related to rapid infusion of lipid emulsions. The correct answer is Option C. Confirm that the fat emulsion is infusing at the prescribed rate and continue as ordered. Even though the infusion is running behind schedule, the safest and most appropriate action is to avoid making any adjustments and allow the fat emulsion to continue at its originally prescribed rate. Lipid emulsions must not be infused rapidly due to the risk of fat overload syndrome, which can lead to serious complications like pancreatitis, respiratory distress, and coagulopathy. Reprogramming the pump to catch up, as in Option A, could result in rapid infusion and hemodynamic instability. Giving a fluid bolus, as in Option B, does nothing to correct the delay and adds unnecessary fluid volume, which may be harmful in clients with hepatic or renal impairment. Pausing the infusion and restarting it later, as in Option D, risks undernourishment and disrupts the intended nutrient delivery schedule. Always prioritize safety and avoid altering infusion rates unless specifically directed by the provider. Time to review some essential prep work with question number 10. The nurse is preparing a client for a scheduled outpatient colonoscopy. To ensure proper bowel cleansing and optimal visualization of the colon during the procedure, which medication should the nurse anticipate being prescribed by the primary healthcare provider during the preparation phase? Let's evaluate the options and determine which one ensures the bowel is thoroughly emptied for the procedure. Option A, bisacodyl suppository. Option B, magnesium sulfate injection. Option C, polyethylene glycol 3350. Option D, omeprazole. Before we go to the correct answer, think about which option provides full bowel cleansing, not just rectal emptying or unrelated treatment. The correct answer is option C, polyethylene glycol 3350. Polyethylene glycol 3350 is an osmotic laxative that draws water into the colon, producing a high-volume, watery output that fully empties the bowel. It is the standard preparation for colonoscopy because it ensures complete cleansing of the colon lining, allowing for clear visualization during the procedure. It's usually given the day before the procedure, mixed in an electrolyte solution, and consumed gradually over several hours. Bisacodyl suppositories only promote rectal evacuation and are not effective as the sole method of bowel prep. Magnesium sulfate injections are used for electrolyte imbalances and are not appropriate in this context. And omeprazole, a proton pump inhibitor, has no role in preparing the bowel. For thorough colon prep, polyethylene glycol 3350 is the go-to agent. Let's move into a case that ties together hematology and pharmacology with question number 11. The nurse is reviewing the medication profile of a client with iron deficiency anemia and recent findings of occult blood in the stool. Which of the following prescribed medications should prompt the nurse to question the order and consult with the primary healthcare provider? Go through the options and think carefully about which medication could pose a danger in the setting of hidden gastrointestinal bleeding. Option A, ferumoxytol. Option B, enoxaparin. Option C, pantoprazole. Option D, epoetin alpha. Before identifying the correct answer, ask yourself, which of these medications might worsen active or suspected bleeding? The correct answer is option B, enoxaparin. Enoxaparin is a low molecular weight heparin that acts as an anticoagulant, and while it's commonly used to prevent or treat blood clots, it is contraindicated in clients with active bleeding. Occult blood in the stool strongly suggests that there is ongoing gastrointestinal bleeding, and giving an anticoagulant in that situation could make things much worse, potentially worsening the anemia and delaying recovery. Ferumoxytol is an appropriate choice because it's an intravenous iron preparation used to treat iron deficiency anemia, especially when oral iron is not tolerated. Pantoprazole is actually protective in this setting because it reduces gastric acid and promotes healing of ulcers. Epoetin alpha helps stimulate red blood cell production and can be part of the anemia management plan, particularly if chronic kidney disease is present. But enoxaparin, in the presence of active or suspected bleeding, is the red flag that requires a prompt call to the provider. Let's focus on nutritional support decisions with question number 12. During a clinical training session, the nurse is reviewing total parenteral nutrition with staff members. Which of the following conditions should the nurse identify as an appropriate indication for initiating total parenteral nutrition therapy? Now take a close look at these options and consider which condition truly requires bypassing the gastrointestinal tract for nutrition. Option A, acute cholecystitis. Option B, gastroenteritis. Option C, irritable bowel syndrome. Option D, pancreatitis. Before selecting the answer, think about which situation calls for complete gastrointestinal rest to avoid exacerbating the condition. The correct answer is option D, pancreatitis. In cases of severe or complicated pancreatitis, clients are often kept nil per us to avoid stimulating pancreatic enzymes that could worsen inflammation. When this restriction continues for an extended period and the client cannot meet nutritional needs orally or enterally, total parenteral nutrition becomes necessary to supply adequate calories and nutrients without involving the gastrointestinal system. In contrast, acute cholecystitis usually involves only brief fasting before surgery or symptom resolution, so total parenteral nutrition is rarely needed. Gastroenteritis is generally short-lived and managed with oral rehydration and gradual return to eating. Irritable bowel syndrome is a chronic condition managed with diet and medications, but the bowel remains functional, so total parenteral nutrition is not indicated. When the gut needs a break and nutrition must continue, total parenteral nutrition is the tool we turn to. And in the case of pancreatitis, that tool can be life-saving. Let's look at how we protect critically ill clients from gastrointestinal complications in question number 13. The nurse is caring for a client in the intensive care unit who is mechanically ventilated via endotracheal tube following a motor vehicle collision that resulted in traumatic brain injury. The primary healthcare provider prescribes famotidine 20 milligrams intravenous push. What is the primary therapeutic purpose of this medication? Now let's evaluate the options and determine which one aligns with why famotidine is being used in this intensive care setting. Option A. Decrease secretions in the respiratory tract. Option B. Prevent the formation of stress-related gastric ulcers. Option C. Facilitate sedation and reduce agitation. Option D. Enhance lower gastrointestinal peristalsis. Before identifying the answer, think about common complications in mechanically ventilated clients and how we prevent them. The correct answer is Option B. Prevent the formation of stress-related gastric ulcers. Famotidine is a histamine 2 receptor antagonist that reduces gastric acid production. In clients in the intensive care unit who are mechanically ventilated or undergoing significant physiologic stress, there is an increased risk for developing stress-related mucosal damage, which can lead to gastrointestinal bleeding. Famotidine helps reduce this risk by suppressing acid secretion and protecting the mucosal lining. It is part of standard prophylactic care for high-risk clients. It does not reduce respiratory secretions. That would be the role of anticholinergic medications like glycopyrrolate. Famotidine is not a sedative, so it does not calm agitation or promote sleep, and it does not promote bowel motility. Prokinetic agents such as metoclopramide would be used for that. In this case, famotidine plays a protective role by reducing gastric acid and preventing ulcers during critical illness. Let's shift our focus to gastrointestinal maintenance in question number 14. The nurse is overseeing a client's treatment diagnosed with diverticulosis who reports difficulty meeting daily fiber intake through diet alone. Which medication should the nurse anticipate the primary healthcare provider will prescribe to assist with fiber supplementation? Take a moment to consider which of these options promotes safe, long-term stool regulation for a condition like diverticulosis. Option A, psyllium. Option B, mineral oil. Option C, loperamide. Option D, senna. Before we reveal the correct answer, think about what the therapeutic goal is in diverticulosis and how to achieve it without increasing pressure or irritation in the colon. The correct answer is option A, psyllium. Psyllium is a natural, bulk-forming laxative that helps increase stool volume and softness, which in turn reduces pressure inside the colon. For clients with diverticulosis, maintaining regular, soft bowel movements is essential to avoid complications like diverticulitis. Psyllium works by absorbing water in the intestine and forming a gel-like bulk that makes stools easier to pass. It's safe for long-term use, but fluid intake is key to preventing fecal impaction. Mineral oil, as in option B, is a lubricant laxative but isn't ideal for long-term use and can interfere with absorption of fat-soluble vitamins. Loperamide, listed in option C, is used to slow down diarrhea and could actually increase the risk of complications by causing stool stasis. Senna, in option D, is a stimulant laxative, and while it may help in short-term constipation, it is not recommended for diverticulosis due to the risk of cramping and increased colonic pressure. Psyllium is the clear choice for safe, effective fiber supplementation in diverticulosis. Hold up. Are you feeling confident about the NCLEX? If not, you'll want to check out the Complete NCLEX Review online course. It's packed with 100 hours of animated videos, 500 hours of deep content, 5,000 practice questions, 500 NGN-style cases, and 15 full mock exams. There's also a full NCLEX eBook included with a 1-year access window. And right now, it's available for 70% off, but only for a short time. Click the link in the description and join the thousands of students who've already passed. Let's explore a high-acuity gastrointestinal scenario in question number 15. The nurse is initiating admission procedures for a client recently diagnosed with acute pancreatitis. The client is experiencing severe epigastric pain, nausea, and abdominal distension. Which medication should the nurse anticipate the primary healthcare provider will prescribe to manage this client's condition? Carefully examine the options to determine which one is most appropriate for managing the hallmark symptom of this diagnosis. Pain. Option A, dicyclomine. Option B, fentanyl. Option C, loperamide. Option D, calcium carbonate. Before selecting the correct answer, think about which of these medications is commonly used to provide potent pain relief in acute inflammatory abdominal conditions. The correct answer is option B, fentanyl. Fentanyl is a powerful opioid analgesic frequently used for managing the intense, often unrelenting epigastric pain associated with acute pancreatitis. Clients may experience radiating pain, nausea, vomiting, and systemic inflammation, and controlling this pain is essential for stabilizing the condition. Fentanyl or other opioids like morphine or hydromorphone may be administered intravenously, and in many cases, patient-controlled analgesia is utilized for continuous relief. Dicyclomine, as in option A, is used for irritable bowel syndrome and can worsen gastric motility issues in pancreatitis. Option C, loperamide, is contraindicated because it slows gut motility, increasing the risk of ileus. Calcium carbonate, option D, is an antacid used for dyspepsia or acid reflux and does not have a role in treating pancreatitis. For acute pancreatitis, fentanyl addresses the core symptom, severe abdominal pain, and is a key component of supportive care. Let's shift to discharge education and medication safety in question number 16. A client with a recent diagnosis of peptic ulcer disease is preparing for discharge from the hospital. During discharge teaching, the nurse should instruct the client to avoid which of the following over-the-counter medications due to the risk of exacerbating the condition. Think carefully about which medication in this list could harm the gastric lining and trigger ulcer complications. Option A, acetaminophen. Option B, aspirin. Option C, simethicone. Option D, calcium carbonate. Before selecting the answer, remember that protecting the gastric mucosa is critical for clients recovering from peptic ulcer disease. The correct answer is option B, aspirin. Aspirin is a non-steroidal anti-inflammatory drug that inhibits prostaglandin synthesis, the very substances that help maintain the protective lining of the stomach. In clients with peptic ulcer disease, taking aspirin increases the risk of gastrointestinal bleeding, mucosal injury, and ulcer recurrence. That's why all non-steroidal anti-inflammatory drugs, including over-the-counter versions like ibuprofen and naproxen, should be avoided unless a provider specifically prescribes them alongside protective agents like proton pump inhibitors. Acetaminophen, listed in option A, is generally considered safe for pain relief in these clients because it does not affect the gastric lining. Simethicone, in option C, is used for gas relief and has no effect on acid production or mucosal protection. Calcium carbonate, option D, is an antacid that can actually help with acid neutralization, though it should be used in moderation. When it comes to protecting the gut, avoiding aspirin is essential for preventing ulcer aggravation and complications. Let's focus on evaluating medication effectiveness in question number 17. The nurse is evaluating a client who has recently started taking dicyclomine as part of their treatment plan for a gastrointestinal condition. Which of the following findings would best indicate that the medication is achieving its desired effect? Review the options carefully and consider what symptom this antispasmodic is specifically designed to relieve. Option A, reduction in abdominal cramping. Option B, absence of nausea and vomiting. Option C, improved urinary output. Option D, resolution of heartburn. Before identifying the correct answer, think about how dicyclomine works and the condition it is typically prescribed for. The correct answer is option A, reduction in abdominal cramping. Dicyclomine is an anticholinergic medication that helps relieve abdominal cramping and spasms, particularly in conditions like irritable bowel syndrome. It reduces smooth muscle contractions in the gastrointestinal tract, which decreases motility and eases pain associated with spasms. That's why a noticeable reduction in abdominal discomfort is the clearest sign the medication is working. Nausea and vomiting, as listed in option B, are not the primary targets of dicyclomine, and it is not considered an antiemetic. Option C, improved urinary output, is unrelated, and, in fact, dicyclomine can cause urinary retention due to its anticholinergic properties. Option D refers to heartburn, which is typically treated with medications like proton pump inhibitors or histamine 2 receptor blockers, not dicyclomine. If a client reports less cramping and abdominal discomfort after starting this medication, you know it's doing exactly what it's supposed to do. Let's take a closer look at symptom-specific treatment in question number 18. The nurse is assessing a client who reports frequent abdominal bloating and discomfort after meals. Which of the following medications would the nurse anticipate being prescribed to relieve symptoms specifically related to excessive intestinal gas? Go through the options carefully and focus on which one targets gas-related discomfort. Option A, simethicone. Option B, docusate sodium. Option C, loperamide. Option D, ranitidine. Before selecting the correct answer, consider which of these medications is designed to address bloating and flatulence without affecting other gastrointestinal functions. The correct answer is option A, simethicone. Simethicone is an anti-foaming agent that reduces the surface tension of gas bubbles in the gastrointestinal tract, allowing them to merge and pass more easily. It's commonly used for relieving symptoms like bloating, pressure, and gas following meals. It's safe, widely available over the counter, and well tolerated. Docusate sodium, listed in option B, is a stool softener that helps relieve constipation, but it has no impact on gas. Loperamide, as seen in option C, is used to treat diarrhea by slowing down gut motility, which could actually worsen gas-related symptoms by leading to retention. Ranitidine, listed in option D, is an acid-reducing agent used for conditions like gastroesophageal reflux disease or peptic ulcer disease, and it does not target intestinal gas. For clients with post-meal bloating and gas, simethicone is the appropriate and effective choice. Before we break down this question, here's a game changer. The Complete NCLEX Review Online course gives you 100 hours of animation, 500 hours of recorded content, 5,000 essential questions, 500 NGN-style clinical cases, and 15 full mock exams. Plus, you'll get a detailed NCLEX ebook with 1-year access. Get in now, 70% off, but not for long. The link's in the description. Thousands of future nurses are already ahead. Don't get left behind. Let's assess the effectiveness of nutritional therapy in question number 19. The nurse is reviewing laboratory results for a client with a history of chronic malnutrition who recently started receiving total parenteral nutrition. Which of the following findings would best indicate that the client is demonstrating a therapeutic response to the treatment? Go through the lab values carefully and identify which one reflects improved nutritional status over time. Option A, hemoglobin, 10.4 grams per deciliter. Option B, albumin, 3.6 grams per deciliter. Option C, potassium, 3.1 milliequivalents per liter. Option D, total bilirubin, 2.4 milligrams per deciliter. Before we choose the correct answer, consider which marker tells us that the body is benefiting from long-term nutrient support. The correct answer is option B, albumin, 3.6 grams per deciliter. Albumin is a key indicator of long-term nutritional status and protein synthesis. A level of 3.6 grams per deciliter is within the normal range and suggests that the client is responding well to total parenteral nutrition, particularly if the value has improved from baseline. It reflects that the body is now receiving adequate protein and calories for tissue repair and metabolic functions. In contrast, a hemoglobin level of 10.4 grams per deciliter, as in option A, is still low and may indicate unresolved anemia. Option C shows a potassium level of 3.1 milliequivalents per liter, which is below the normal range and reflects an electrolyte imbalance, something that needs correction, not a sign of progress. Option D, a total bilirubin of 2.4 milligrams per deciliter, is elevated and may indicate liver complications from total parenteral nutrition. In short, albumin within the normal range gives us the best evidence that total parenteral nutrition is working effectively. Let's wrap up with a question focused on client education and medication safety in question number 20. The nurse is providing discharge education to a client who has been prescribed metronidazole for a bacterial infection. Which of the following client statements indicates that the teaching has been effective? Carefully consider which response shows that the client understands how to safely take this medication. Option A. I'll make sure to avoid alcohol while I'm taking this medication and for a few days after I finish it. Option B. If I miss a dose, I should double the next one to catch up. Option C. Once I feel better, I can stop taking the medication. Option D. It's okay to take this medication with herbal supplements if I need to. Before choosing the correct answer, think about which statement demonstrates the safest and most accurate understanding of how to take metronidazole. The correct answer is Option A. I'll make sure to avoid alcohol while I'm taking this medication and for a few days after I finish it. Metronidazole can cause a severe disulfiram-like reaction if taken with alcohol, resulting in nausea, vomiting, flushing, and abdominal cramping. It's essential that clients avoid alcohol during treatment and for at least 3 days after the last dose. This statement shows that the client is aware of one of the most critical safety concerns. Option B is incorrect because doubling up on doses increases the risk of side effects and toxicity. Option C is dangerous because stopping the medication early can lead to treatment failure and antibiotic resistance. Option D is also incorrect since herbal supplements can interact with metronidazole, and clients should always consult their healthcare provider before combining therapies. Avoiding alcohol and completing the full course of antibiotics are both crucial points for successful treatment with metronidazole. That brings us to the end of today's deep dive into pharmacology of the gastrointestinal system, a critical topic packed with high-yield NCLEX questions every nursing student needs to master. We release new NCLEX videos every single day, covering the exact topics and question formats you're likely to see on the exam. So make sure to follow us, watch regularly, and build this into your daily study routine. Stay consistent, stay focused, and we'll see you in the next video.